Our data related to influenza are collected using two surveillance systems. Routine surveillance system that include 36 public health centers and Sentinel surveillance system with 9 public health centers. The Sentinel surveillance system collect data, specific data and non-specific indicators like school absenteeism, drug consumption. The objective of this study is to analyze the morbidity, mortality, to estimate the evolution of epidemics from influenza-like illness, acute respiratory infection, and severe acute respiratory infection in Moldova for the period 2010-2015. Data source for this study was influenza surveillance system, routine and Sentinel. All the cases were reported by the doctors to the centers of public health. It's a retrospective study for the period 2010-2015 with focus on influenza season, and all the influenza cases were confirmed by PCR. The case definition for Yili, Ari, and Sari, it's the case definition from WHO. And the declaration of all these cases is according to the International Classification of Disease number 10. Here in this slide, we have the evolution of Ili, Ari, and Sari for these 5 seasons, and we see that each year we registered an increasing number of this disease, and usually it's in the winter time for the North Hemisphere. If we'll look to the to the distribution by age groups, for Yili we have the most affected age group. It's 5 to 14 years. And at the second place, it's age group 0 to 4 years. For ARI cases, it's a little bit different, and the biggest number of the case it's registered in the age group 0 to 4. At the second place, it's age group 5 to 14 years. Practically the same situation it's in the case of Sari, where we have the most affected age group, it's 0 to 4 years, but here we have the age group more than 65 years that have a high prevalence of Sari. The results, this slide presents the results of influenza virus type for this 5 seasons. We have the number of samples, the number of positive samples, and the number of positive samples by type. So we see that for we have in each year one dominant type of influenza. In 2010, 2011, 2012, and 2013, and 2014, 2015 was AH1N1. But for the period 2011, 2012, and in 2013, 2014 was AH3N2. In season 2014-2015, we have two types, AH1N1 and influenza type B. If we'll look to this slide, we'll see that the number of death cases linked with influenza. We have in this period of 5 years 47 cases of death, and the distribution it's different from 1 year to other. Rate of the mortality was from 0.11 until 0.6 cases by 100,000. All these 47 cases was not vaccinated and with chronic comorbidities. In conclusion, we have that the incidence of ELI, ARI, and Sari cases have clearly seasonal manifestation, and the most affected age group for ELI it's 5 to 14 years, and for ARI and Sari it's different, it's 0 to 4 years. The predominant types of influenza in this period was AH1N1 and AH3N2. And in our country, the mortality varied in this period. The recommendation for reducing the number of ELI, ARI, and Sari cases, yes, it's necessary to implement some preventive measures, such as improve awareness of general population concerning to the measures to be taken to prevent the ELI, ARI, and the Sari, to have training with healthcare workers, and in this training to include how to prevent, to detect, and to respond in case of ELI, ARI, and Sari, including hand hygiene, personal protection equipment. And one of the best methods to prevent it's the vaccination of high-risk groups and the population in general. And I want to say thank you to these people, my friends from this room, and not only, and for my team from Tirana. Thank you.
Dumitru, thank you very much to bringing the experience of surveillance system, or to collect data from two surveillance system, routine or passive surveillance system and sentinel surveillance system. And now floor is open for questions, comments, and discussions. Yes, Silvia, please.
I just have a question. When I saw your slides, you had much more cases in children compared to adults. Is this because adults do not go to primary care, or it is because something within the surveillance system? I understand that children can be more. And also in the isolation of viruses, you had more viruses in children, isolating children than adults, I think.
Okay. Why I think the biggest number of cases are at the children, because the children when they get sick, their parents go to the hospital and they are registered like a new case. But the older person, okay, it will pass, it's something for our country, it's like this, it's something normal, I can say.
Thank you. Vladimir, would you like to?
Thank you for your presentation. It was very informative. I have one similar question to Sylvia, but regarding to Sari cases, one would expect to have higher incidence in older age groups of severe acute respiratory infections than in children. Can you explain that a little bit? Maybe do you have answer on that? Because in our country, let's say we have more severe acute respiratory infections within the older and elderly patients. It was in your own conclusion.
Yes, about Sari. You asked about Sari. Why we have more cases in children than in older person? I think it's the same. They go to the primary healthcare centers if the children it's sick, they will go to the health center, to the family doctor. But at the older, maybe not all the person have the possibility to go to the hospitals, or they think it's not so severe. I don't know. This is how I think it's the situation.
Thank you for your answer. Yeah, I would agree in most part of that. Although for severe, let's say, manifestation of influenza, you would expect that people should be hospitalized, and usually it's older people. So maybe that's also your explanation. Okay, thank you.
Yes, please.
Dragana from Serbia. Thank you, firstly. And Alexei, you mentioned, Dmitry, sorry. Dmitry, you mentioned, do you have sentinel surveillance for Ili and Sari both, or only for Sari?
It's for both.
Both, okay. Yeah. And another question, how many doctors are included in sentinel surveillance for Ili, and the percent of coverage according to sentinel surveillance for Ili?
Okay, the sentinel surveillance include approximately 120 doctors. Yes, 120 doctors for all the country. And the second part of the questions, percent of coverage
for your sentinel surveillance for Ili. Percentage of population.
Yes, I understood. It's need to approximately 30%, because I try to remember the number of population from this sentinel site, and it's approximately 30%.
Okay, thank you.
Thank you.
Thank you. Do we have any other questions or comments?
Hello. If there is no questions, my name is Konstantin Remish. I'm a member of scientific board in Moldova, and of course I cannot exclude not to saying something, because first of all I would like to congratulate my colleagues for these nice presentations, and very important to say that one point, it is what was mentioned by you, it is the health demand, health service demand of, and I'm sure that you face the same situation in this region. Another point, we have to address this awareness of general population and to explain how they have to react. There is one thing that about the perception. You know, there is a joke that influenza-like infections, if you will treat, they will pass in 7 days. If you will not treat, 1 week. So this perception in general population make people not to go to the health system and not to address this situation. It is very important to discuss and to explain the population. And the second point, the good presentation of important point here, if you saw the increasing of Sari, it means year by year the system increase their capacity to detect finally and to address the situation. So in fact there are another point of vaccination, and as in general immunization program, we face one important things. The doctors, instead of promotion vaccination, they make some avoiding. We discussed yesterday concerning the false contraindication, and that's why we have to promote all these measures in general population, healthcare workers, and the specific measures. Thank you very much, and congratulations for the product.